Hey all, welcome to another Mozilla Dialogues and Debates. Just as you guys know, just a heads up, this call will be recorded and then published online for the entire world to see. So don't pick your nose, don't do anything embarrassing, make sure you're looking good. Today we're talking about contact tracing. This has been in the news a lot lately. So we have a panel here for you guys. And my name is Xavier Harding. I am a writer here at Mozilla. And today is actually the first time in months I put on an actual shirt. So before we talk about any of the contact tracing stuff, I'm hoping we can introduce our panelists today with your name, what you do, and last time you wore clothes that were not sweatpants or workout clothes or something you would wear outside. So I guess we can go in alphabetical order. So maybe start with Divij.
Hi, thanks for the intro, Xavier. My name is Divij Joshi. I'm a Mozilla Tech Policy Fellow based out of India. And my project pursues looking at the AI information economy and making it more sustainable, and in line with legal and constitutional values. More recently, I've been looking into the kind of technological interventions being deployed in the face of this pandemic and how they can be improved or whether they should be deployed at all. I had to change my shirt, I must admit, before joining this call. I was in a t-shirt and pajamas, but now I'm in a kurta and pajamas. So.
You look good. I'm actually wearing half pajamas right now, admittedly. Okay, so Frederic.
My name is Friederike Kalteiner. I'm also a tech policy fellow. I'm usually based in London, but I'm currently in Germany with family. I had a call before this, so I'm already I got already dressed. My fellowship work is around AI, hype, and pseudoscience, but my background used to be in privacy and security. I used to work at Privacy International in London before joining the fellowship.
Great. Mark?
Oh, I didn't know that I was actually a part of the panel. So Mark Sermon, Executive Director of Mozilla, and certainly very interested to hear what all the fellows have to say, and have been doing a lot of reading on all the contact tracing questions, and can share sort of some summaries of what I've been seeing, if that's helpful.
Very cool. Marshall?
Marshall Irwin, I'm the Senior Director of Trust and Security at Mozilla. I work on a bunch of privacy and security initiatives, both in our products as well as our external policy work. I've been getting dressed up every day to maintain some sense of normalcy in my life.
And last but not least, Richard.
Hey everybody, Richard Witt. I'm a fellow second year with Mozilla based here in the Northern California, San Francisco Bay Area. And I'm wearing my intermediation shirt, so specially for this occasion. So for those of us in the Valley, this is in fact being dressed up.
So we can dive right into the talk. So we're talking today about contact tracing. What exactly is contact tracing and why has it been in the news lately? Anybody can kind of raise their hand and answer that one. And I should mention, by default, you're on mute. So raising your hand kind of helps us out with seeing who we should choose on.
Well, I'm happy to go first as the generalist and not the expert. Really we're talking about the idea that we may, as we try to move out of social distancing, be able to manage the pandemic by tracing people who've been in contact with people who test positive to COVID. And that's a long-standing public health practice of public health officials interviewing people who have tested positive about who they've been in touch with. But the proposal, and it's certainly something that's been implemented in a number of jurisdictions like Taiwan and Singapore and China, is to do that digitally through our smartphones and seeing who we're in proximity with. And there's two broad approaches to that. One more centralized, which is collecting information that public health officials would see about who people have been in contact with, and a more decentralized approach like the Apple and Google one, which would not inform public health officials. It would only inform people that they had been in touch with somebody who had tested positive and require them to act on their own.
Yeah, and then why is this something that we might be worried about? Mark or anyone?
This is Richard, I'll jump in. So as Mark mentioned, there are different forms and flavors of contact tracing. It is a long-standing practice within the healthcare industry to contact people when they think they might have been associated with somebody who has symptoms of a disease. But this is now really the first time en masse it's being used in a digital context. And you have large companies like Google and Apple making proposals, as they did about 10 days ago now, to use contact tracing as a way to obviously further healthcare concerns and interests. That's a good thing. But then behind the scenes, of course, lots and lots of questions. As Mark mentioned, there are some decentralized ways of doing this, using Bluetooth, for example, and ensuring that the information that's passed between phones is done in sort of a randomized manner where there's no personal information involved. Then there's the more centralized approach, using things like GPS or location tracking through our cell phones, where in fact PII very well may get passed not between even the individuals, but directly to health authorities, government officials, and perhaps others. So depending on the models that are being utilized here, and there are a number based on the different countries and companies involved, it raises, I think, some pretty significant privacy and autonomy concerns for average human beings.
Yeah, we're talking right now about Apple and Google, and that's very United States focused. So we'll broaden out to the global perspective in a second. But when it comes to Apple and Google's solution, there are reports that they are using Bluetooth, they're not using GPS, and that they use an anonymous key. How do we feel about that? Is that good enough? Like, why might that not be good enough? Why is that a good way to do it?
Can I just jump in one more time on the previous question? I think there are privacy and security respecting design choices you can make to make this as responsible as possible in combination with legal safeguards. But I think it's really important to recognize that by definition, this is something that's incredibly invasive. And in the absence of a pandemic, this is something we would never want to be doing. So whatever is proposed, and there are a number of principles that are really important, is that what's really important is to really recognize that this is an inherently risky technology. It has to be used, it has to be absolutely necessary, it has to be used proportionately, and there have to be legal and technical safeguards. So that's why this discussion is so incredibly important. And the second component is there are a number of conditions which need to be met for this to be useful in the first place. One of them is, in the absence of any kind of testing, there's no way for people to notify who they've been in touch with, because they will never know if they have the virus or not. And in the absence of manual contact tracing, we will always leave out people who don't have phones, whose phones don't have the technical capacity to do this kind of contact tracing, or simple people who can't charge their phones regularly. So I think this is a very nuanced topic.
You raised a lot of good points. I want to follow one, and we'll go back to another. You mentioned that we're not even really doing testing to effectively complement this contact tracing. If we were doing testing, would this be an okay thing to do? Would you be cool with it then?
I'm generally, I think, so people have been asking me, like, as somebody who is in favor of privacy, are you okay with privacy being compromised? And I think anybody who either knows somebody who's lost their job, who is depressed at home, that we all want this to be over and solved. So this isn't really the question. So the question isn't really, should we trade one for the other? It's, is this actually necessary and is this effective? And that's not for me to decide, that's for epidemiologists to decide. And once we agree that this is effective and useful, how can we do this responsibly? And that's the key question. So what are the safeguards that we need? How can we build this in a way that this works? And I think it is important, I love that Mark said this at the beginning, the idea of contact tracing comes from epidemiology, that you need to test and track and trace all the cases that you know. So this is sort of the backbone of this strategy. I think this is not the time for any sort of, this won't be a magic bullet, and this is not a technological solutionism. If anything, it can maybe ease the burden on health authorities who currently have to do this manually, if it is done correctly.
Got it.
I mean,
Yeah.
maybe,
Can I jump in on this question about trade-offs
Sure, go
for
ahead,
a moment
Marshall.
between privacy and health? So I think that this is a really interesting question, and it's a question that this trade-offs issue comes up in a lot of other contexts that we're all very familiar with, where we sort of are navigating our online life and feel like we are stuck in this sort of false choice between privacy and our ability to live online in a way that makes us all really uncomfortable and almost makes us feel like we've been kind of trapped by the major platforms. And again, I think that's a problem we're all pretty familiar with. In this context, it almost feels like a much healthier choice. it's one that we all explicitly can recognize. And that's not to say that there aren't real downsides and costs here, but there's an explicit trade-off. And I don't feel trapped by that choice in a way that I feel trapped in a way that we often do when we live online. I feel like there's certain information that I might need to disclose in order to make my neighbors and my family healthier. And that's a choice that I can make, and I can understand the implications in a way that I think it's a unique trade-off, and it's a different way of thinking about privacy than we typically do on a day-to-day basis, which, like I said, in a day-to-day basis, we feel trapped by these privacy choices in a way that feels inherently unhealthy, rather than being able to make a pro-privacy choice or to disclose information that can help other people. So I just wanted to, that's kind of how I'm thinking about this trade-off in a way that, like I said, it feels different than the normal privacy choices that we make, and actually better. And I'm glad that we are having this conversation and able to have that explicit trade-off.
There's some other people who jumped in before. Does anybody else want to weigh in on that? Divish, did you have something you want to mention?
Yeah, just to add on to that point about trade-offs and balancing of rights or balancing of different considerations. It's also very useful, I think, to keep in mind that human rights law has always recognized that privacy and healthcare are related rights. They're not necessarily antithetical to each other. So when we saw, for example, in the HIV/AIDS epidemic, the fact that certain laws invaded privacy a lot, it actually meant that people wouldn't approach healthcare authorities. And when you're kind of taking away from people's privacy and their autonomy or their dignity even, that needs to come into consideration as a related right to actually making better healthcare systems. Because if people aren't going to report themselves, will not approach public health authorities because they don't feel that their data is secure or they feel that their privacy is being impinged, then it runs antithetical. So I think maybe the trade-off discourse needs to be a little, it needs to be seen as two rights that are related and not necessarily things that need to be balanced or struck off against each other.
Yeah, one question I want to ask you guys. Oh, go ahead,
Can I just
Mark.
jump in with one other worry that I mean, I think all of, and especially Frederica's comments really kind of set us up into the fact that this isn't, there's a set of worries and a set of trade-offs about the current use of the technology we're talking about for contact tracing. One thing I would just add on top of that, and somebody just asked the question in the chat, how do we prevent this from being used in the future for less important reasons? Just, while we're still on worries, I think we also want to look in the future about what norms we may be setting. And I've been doing a lot of reflecting on this. My gut is to be really concerned that we may be setting norms for the future that are much more invasive than what we are willing to accept now, or set up technologies that may get used in different ways, as that question implies. The other thing I would say, though, is, and maybe we'll get into some of this, what's been really heartening is a number of governments and tech companies, but especially the kind of community around Mozilla, has jumped forward with a lot of privacy by design thinking and a lot of good thinking on how this would be governed and all of those questions. There's also a chance to potentially set some positive norms in this setting as we look at the trade-offs. And that, to me, is really exciting. Like we could be teeing ourselves up for an increased dystopian future, but we actually have an opening here to do some of the things we've all talked about for decades.
So for folks who are watching this at a later date, a Mozilla person chimed in our chat asking, how do we make sure this isn't used down the road for less important reasons? So my question would be, is there a way we can make sure that the contact tracing in this form isn't used in this way from now on, like for the rest of time? Is there a way we can make it kind of a temporary solution? How would that look?
I think I want to, something that we worked on so I helped a number of academics write a bill in the UK that would address some of the legal challenges of this. And I think one important thing we haven't really touched upon is, I think in a democracy, this has to be strictly voluntary, which means that people will only download and use this app if they think it is worthy of their trust, which is why I like the word trustworthy technology. It means the technology has to be built in a way that people feel comfortable using it. So in the legal safeguards, what we guaranteed, one thing is this has to be time limited, and there has to be a regular review, an independent review, which makes the decision whether this is still needed. There have to be complaint mechanisms. Who do you complain to if you feel like this is doing something it's not supposed to do? And something I feel very strongly about, which gets lost in the privacy discussion, is something we added to the bill was sort of nobody should ever get fined for not having a phone, not carrying a phone, or not charging their phone, because we know that there are very good reasons for things to happen. So there's a package of principles, including that it has to be grounded in epidemiological guidance. Something else I wanted to add to the previous point about privacy is that it does feel different from the normal online choices, but the common misunderstanding in both of them is that privacy is something that is primarily about the individual or my choices. Whereas the floodgates, sort of, if this is not time limited, this is not just about me and what data is shared about me, it's also sort of what does a world look like where governments can trace people's movements. And it's often, if you're privileged and comfortable, the harms are often not about you. You're very likely not to experience any harms, but harms are disproportionately going to be felt by certain kinds of people. So we don't want people to be discriminated, excluded because they're sick, or to be stigmatized. Those are all sort of questions. The moment that health data becomes leaked or sold or public, those are like, there are a number of nightmare scenarios that could happen.
Yeah, Marshall, you want to get in there?
Yeah, it's worth quickly tacking back to the question about Apple and Google for a moment, because I think the interesting thing about their proposal, and it has a number of benefits and drawbacks, but the decentralized approach that they have means that there's more data that stays on your device and less data that is provided to the government. And in practice, that means there's less data that can be abused. There's less of a slippery slope that we can all sort of start to travel down. So I think that's really the main benefit of those approaches, of those more decentralized approaches, like the Apple and Google approach, is that it is less prone to abuse. Now, what this doesn't actually do, though, is solve for Mark's other point, which is kind of the norms question. Irrespective of the particulars of the technology, there's a norm-setting element of what is happening here, and we still need to be wary of that, regardless of whether we're taking the decentralized approaches or centralized approaches. And that's why I think the points that Frederick made were really important, like the norm about, like, should people be fined for not having a phone or not installing an app? Should people be required to install this stuff? I think my answer is similar, which is no, regardless of what the particular design is. People shouldn't be required to do those things, because that's really going to be the most critical norm going forward that we establish one way or the other.
Yeah, Richard, you had your hand raised?
Yeah, I was going to say the conversation already reveals that we need the norms, the governance, I think is the word that some of us use, ahead of the technology. And the challenge we have is, I'm assuming a month or two ago, very few people knew what contact tracing even was. And so even today, many people in the general population are struggling to understand what it means. And as we've already touched on, there are many flavors of it. There are different versions of it. And we haven't even gotten to, I think, things beyond this gateway application, things like using GPS to monitor populations. In New Zealand and Thailand and Taiwan are using GPS to monitor whether people are staying in quarantine. Obviously, places like China, Russia, Poland are using facial recognition to decide whether people are breaking quarantine and issuing big fines against them. So this is in some ways the easiest conversation around the easiest, or maybe the most sort of privacy supportive approach, which is, I think, where Google and Apple largely are going, and then other variations within contact tracing, but many other technologies down the road coming at us pretty quickly. And as a society, we're going to have to figure this out, I think, on a much faster pace than normally we would be doing. And these kinds of deliberations are done in a much better way, as Frederick points out, as a democratic process, as one where all citizens are involved, and we establish the norms, the standards, the requirements ahead of time, rather than waiting for the tech to sort of rush at us in ways that we can't really comprehend.
Yeah, I have a tough question. So, we've seen a lot of reasons why companies want to track us in the past. Facebook wants to track my entire web history so they can tell me what underwear I should buy, what pants I should buy, serve me those ads. I've been wearing sweatpants all this time. They want me to finally wear some real pants. When it comes to contact tracing, is this the best reason we've seen yet to give up our privacy? If it would save lives and if it was combined with actual proper testing, is this the best reason we've seen yet to kind of give up our privacy?
That's a lot of ifs. As Freddie pointed out, we don't have enough testing to even make this an efficacious approach yet. It may become a better approach down the road, but right now, I think it's hard pressed to say that this is the thing that has demonstrated that you can pass those initial hurdles of whether it's effective and meets all of the privacy norms that we would like to think we've established ahead of time.
Yeah, Frederic?
And I think the reason why I don't like the trade-off framing is that, yes, there are maybe some trade-offs, but in many instances, it's actually not a trade-off, it's just a decision whether we are deciding to build responsible and trustworthy technology or whether we're not deciding the same. And I want to give one example. There's now been a news report from today that an app where you can use sort of like type in your symptoms and find out whether you have a chance of having been infected with the coronavirus has been found to share this data. In their privacy policy, they say that they're selling and sharing this data. So that's why we have to be very careful. And that's why sort of, well, we all know how terrible many apps are being built. There are trackers inbuilt, the data can be shared. All of this is how most of tech is currently being built. So all of this is sort of, that's a choice. This has never been necessary for non-contact tracing app, and we really shouldn't accept this even as a trade-off. It has no use purpose. It doesn't improve the contact tracing. It's just a poor design choice.
Got it. You know, if we want to broaden out to the global view, we've seen a lot of countries tackling this contact tracing issue. We've seen China, who's been ranking, many cities in China, not every city, has been ranking citizens' health and then tracking them wherever they go. We've seen Apple and Google here in the US wanting to do what we've been talking about. We've seen New Zealand who have suggested either like, you know, analog solutions where you kind of write down who you came in contact with, as well as they have a kind of like a card, or, well, it hasn't happened yet, but you might be able to buy a card where that is what will track you throughout the world. Are one of those kinds of options better for us? Like, Frederic, you mentioned that not everybody has a phone, not everybody can charge their phone often. Should there be a physical thing you can carry around with you and opt out, you just leave it at home? Is that a better solution? I named Frederic, but anybody can answer. Anybody can answer that one. I didn't mean to put you on the spot.
Just on your point that, yeah.
Go ahead, Frederica.
Okay.
No, just sort of, not everyone has a phone. Is sort of, I think this is a global pandemic, and contact tracing, the moment people cross borders, these systems have to be interoperable and they have to work across borders. It's like, I don't know the exact, I think half the world's population, I think last year, was now connected to the internet. So Mark must know the number. It's not just that some people don't have a phone, it's that lots of people don't have a phone. And many of these phones don't have Bluetooth, like don't have the technical capability to be interoperable with the apps that are being suggested.
Yeah, and then Divish?
Thanks. Yeah, I agree completely that, you know, all of these deployments ultimately depend to a large extent on the kind of context in which they're being deployed, the economic and the social context. You know, one of them is, of course, the technological context strictly, like how many people have phones, how many of them are using them. You know, how directly can you map on one phone to one user? Often it's one phone to a family. And within that, it's very, say, gendered or driven by other considerations. So women will not have a phone while the man in the house might have a phone. Apart from that, I think, you know, when we're looking at maybe within the balancing or the trade-off discussion, it's also imperative to keep in mind, you know, the kind of legal context or the political context in which it's being deployed. Because what I'm seeing in India is that, you know, public health authorities are not involved in contact tracing through the apps. They're still looking at human contact tracing and kind of, you know, making policy decisions based on that. But it's the police and, you know, like private tech developers who are mostly interested in this data. And why do they want to do that? A lot of it is driven and tied in with kind of the authoritarianism of India's current government and other similar kind of factors, or the fact that this is very valuable and potentially, you know, data which can be mined for a lot of money. So like all of those considerations need to play in apart from just like simply the technological considerations.
Yeah, and I think Marshall had his hand up.
Yeah, so you had asked specifically about the digital card proposals, which I think are really interesting. They actually have roughly the same set of privacy properties as these phone-based Bluetooth solutions. But what they're actually doing is solving for these other inequities. Not everyone has a phone, but maybe you can get something with the same basic Bluetooth properties, but much cheaper to a larger set of the population. And so, like I said, the privacy properties are very similar to these other solutions. It's actually the other things that are different. It just shows kind of overall what I think we're seeing in a number of different contexts, which is that like the pandemic is unearthing the basic inequities that we all kind of knew already existed. Not everybody can telework. Not everybody can suddenly join a Zoom call like we can. I can easily adapt to this environment. People in other parts of the world or other parts of the country might not be able to do so. That's kind of what we're seeing here in the context tracing context as well. It will be easier to do this with a phone-based solution for some populations other than others.
Yeah. Mozilla employee Alan Davison chimed in the chat talking about how the German government is exploring building millions of cheap Bluetooth beacons for school children and others who don't have Bluetooth phones. Does this address our inclusion concern, or does that scare the heck out of us? It definitely scares me. I don't know if that's a better solution than the card situation or Apple and Google's version. What do you guys think?
Well, the end of Alan's is, does that address the inclusion concern or scare the heck out of us, or both? And I think the answer for me is both. And it goes back to the question you asked earlier, Xavier, is this worth making a trade-off for our privacy, or the best reason? And the thing I would say in all of this is I keep going back to, we already live in a world where we're trading off our privacy every day for lots of things, for free content and services, for just being able to use the things that we're engaged in every day. And it goes back to ties back to what Marshall just said, is those things are just exacerbated in the current situation where we're more digital, and it comes down to the design choices what design choices are we going to make. So to me, it's in the case of, is the Bluetooth beacon scarier than the smartphone? It's really, what design choices are we making in it? And I really want to think about how can we use that. The real opportunity here is to get people having a different conversation about those design choices. Different people in government who have a tough time having these conversations. Companies who often say, well, it's hard to do privacy by design. It's not going to actually give people services they want. There is a chance in each of these settings to be having that conversation about what are the design norms around privacy that we want to be applying.
Yeah, and Richard, you had your hand up?
Yeah, this raises the old battle lines between opt-in and opt-out, right? I mean, so the current approach is these are applicate for, let's say, for Google and Apple, and presumably in Germany, although I don't know the details there, is that this is still an opt-in regime where people have to affirmatively download the application, use it in some fashion. But that line is blurry, and as Mark mentions, we opt into lots of things online just by being there. Our presence there creates privacy risks for us all the time. And then it's also worth looking at the Google Apple proposal. It's really a two-step approach. The first step is an application using an API on the phone, and that is an opt-in approach. And I think the privacy enhancing measures there are helpful. But then there's a second phase I think people are not focusing on as much, which is in the next couple months, they're actually going to embed this functionality into the operating system. So into iOS, into Android. So at that point, roughly 3 billion devices on this planet are going to have that functionality there. And to me, it raises huge questions about, okay, is that going to be opt-in? Is that going to be opt-out? Where is the consent, to the extent consent, actually meaningful consent can work in this environment? Where is the governance around how that's going to work? And so that to me raises some of the bigger, thornier questions about trying to establish these norms and standards ahead of time rather than waiting for the technology to hit us first.
Yeah, I'd imagine that folks who advocate for contact tracing would say that the system of contact tracing, digitally contact tracing, only would work if everybody was doing it, and they would probably say that's why it has to
Absolutely.
be on by default. So are we cool with that? Or would you guys say, no, it still has to be opt into it, affirmative, yes, I have to check the box? Do we think that that should still be the case, or if we're going to do it, should we go all in, and should we just have it?
Yeah,
I would say we have to check the box. Yeah, go ahead.
Yeah, I think you still have to check the box. I'll just to piggyback on Richard's points to explain kind of why I think that needs to be the case. The Apple and Google proposal I think is really strong, but there's still a fundamental problem in that there's a bit of privacy theater happening with it. It has a strong set of anonymity properties, but the fact is when when I find out that someone in my neighborhood has been infected, I'm going to want to know who that person is, and I'm going to talk to my neighbors. And so inherently, this is going to be sensitive, and people are going to be like re-identified regardless of whatever properties Apple and Google build into the system. And that means, and maybe that's okay. Maybe like, but we should maybe like put aside the theater and say, Marshall, tell your neighbors that you have been infected so that they can protect themselves and know that they've been in contact with you. And I think that would be a preferable approach to one that is inherently privacy sensitive, pretends that you are going to be protected, and forces you to opt into these things. We should just say, like, look, opt in, check the box, and know that you are going to be disclosing something sensitive to other people, or choose not to do so. I think that's a more appropriate frame.
Yeah, and Frederick, you had your hand up?
I also think the current proposal is that it is still sort of, you decide to download the app, then you also either decide or you don't have a choice because there are no tests to get tested when you have symptoms. And then when you test positive, it's still you who indicates in the app that you have tested positive. So there are many choices you have to make. And I think the voluntary principle is really powerful, because if it's forced upon people, people always find ways to trick the technology. You can leave your phone at home, you can turn it off, you can pretend the battery. There's so many ways and loopholes. So you need people's buy-in anyways for this to work. So why not make it strictly voluntary? I think I just want to, because people have been saying this, is this really the Google and Apple proposal? There have been proposals for decentralized solutions before they joined the discussion. What I thought is sort of the fact that it's interoperable between these two systems is kind of important, that they can talk to each other. But also, obviously, even if it's voluntary, I read the numbers in Germany where you would still need a significant proportion of people to use this one app. And in Germany, I think the people who use WhatsApp, which is the most popular app, is 70% of the population. So you need this app to suddenly become the most popular app in a country, which is a really, really difficult task to accomplish, which is probably easier if you have the buying, if it's sort of offered to you on the App Store as like, this is the app you need to, or you can download.
Yeah, I want to take one more question from our chat, and then I want to expand it to our Twitter audience. But Jennifer on the Firefox team had a great question. She wanted someone to explain once again why epidemiologists trace epidemics in the first place, and what decisions can we make? What decisions can't we make without tracing epidemics, and what decisions can we make when we trace them? Basically, like, why do we need to trace in the first place? Just for folks who may not know. Individual. Yeah.
Right. So digital contact tracing, and we kind of discussed this, has kind of historically developed from how epidemics have been dealt with in the past, and this stems back to, say, the plague. So in India, for example, the act that we're now relying upon is a legislation from the late 1900s. From the late 1800s, and it's essentially because this is a pandemic which spreads and jumps from one person to the next. For public health authorities to be ahead of the curve, or to actually know how this is going to spread and who it may have reached, it's necessary to know who an affected person has contacted, right? That's normally done by conducting interviews, by conducting testing, by looking at people's symptoms and kind of having a very public health or like a clinical approach to it. Unfortunately, and this is again like an important point, is what are the limitations of the assumptions we're making about digital contact tracing, particularly if they don't rely on testing, which is clinical health information, and they only rely on proximity. These are all proxies for how a disease can spread, and it's certainly is not necessary that just because you've been in close contact with someone, say a meter away from someone, that you might have infected them or been affected by them. And that, I think, is something that really needs to come into consideration when we decide how we use these apps and for what purpose we use them. Because if we're assuming that just because I've come in contact with 100 people through my Bluetooth beacon, that all those 100 people are affected, and then based on that, say the government makes a decision to quarantine all of those individuals, that's going to be, in the absence of clinical testing, that's going to be a huge infringement on other rights that people have, not just privacy, but mobility and freedom of contract and all of that. So which is why I think definitely, like, we need to rope in epidemiologists into this. We need to rope in public health authorities and massively expand testing for this to be effective for anything. Otherwise, we're relying on false assumptions and proxies for clinical data, which can be really harmful.
Yeah, going back to assumptions, Division, I want to talk to you about, I'm based in New York, so like the idea of contact tracing kind of makes sense in a city context. But how about elsewhere? Like, are there any oversights when we kind of zoom out to places that might not be cities, places that might not have, like, what kind of things are we overlooking when it comes to contact tracing?
Yeah, I definitely think, at least in the city that I'm in, or in major cities in India, there's almost two kinds of quarantine efforts that have been going on, because people who are out on the streets or the migrant laborers have absolutely no quarantining efforts that are going on. So that's obviously one limitation, in that it's social distancing is effectively an impossibility for many people. The second, of course, is again to go back to the assumptions and the harmful effects of kind of this technological solutionism. And this isn't new. So there's a fascinating paper or a case study of the Ebola crisis in Sierra Leone, and how everybody wanted to jump in. And there's the Ebola crisis. There's also Google flu trends, which were spectacular failures because they made certain assumptions about cell phone ownership. They made certain assumptions about how GPS technologies work and how effectively they can actually locate people. So there's a lot of fundamental flaws with this techno-solutionism, not just about how many people have access to the technologies, but how capable these technologies are in various contexts and whether they would work at all. And I think that ultimately it can get very harmful as well, because it serves as a distraction where the governments can claim that they're doing something, that you have managed to trace 1 billion people, whereas they've made actually just faulty or potentially discriminatory and exclusionary assumptions about people and about this disease, while not actually doing anything to solve the crisis.
Yeah. Anyone else want to jump in there? Like, I'm thinking maybe like a rural community, like that maybe contact tracing apps may not work so well in those kinds of places. Are there any other kind of context? Frederick, do you want to?
I think I just want to stress what Divij said, that because it's something I had not fully like grasped the gravity of it. Sort of without testing, contact tracing doesn't make any sense, but it also doesn't make any sense. So you've been warned now that you've been in contact with someone who was sick. The next step you need to take is you need to quarantine yourself. You need to isolate yourself. If you can't do that, there's no, the value of you knowing that you've been in contact with someone is very limited. And the limitations to being able to isolate can be you can't afford to not go to work for 2 weeks because there are no benefits, or because you make so little money, or the other one is just physical. You have no physical space where you can quarantine and isolate. So I think those two, without these two, this raises the value is sort of significantly reduced.
Yeah, that makes a lot. And Marshall, you want to jump in?
Yeah. I'll I'm going to duck the question about kind of rural communities, but to make a related point, which is that, none of us are epidemiologists, but we all are sort of privacy experts and tech experts. And I think we have seen in the tech community, we know everything and can solve every problem. And all of us have seen the pitfalls of that approach. And so like, I can't tell you how to solve this in rural communities. I think, there are plenty of other experts who you can talk to. I think what you pick up on this this call is some amount of skepticism about the efficacy here, in a sense that like there's a lot of people trying to advance solutions such without a firm understanding of exactly what the problems are and what can be most effective. And the general sort of approach that I am bringing to my work at this point is to try to be really humble about what I know and what I can solve for, and to not represent myself as an expert about sort of contact tracing in rural communities, which isn't to suggest that it was a bad question. It's exactly the right question. But like I said, I think we all want to be humble about like what we know at this point, rather than your more traditional approach, which is, like I said, knowing everything and solving every problem all at once.
For sure, yeah. Going back to what we don't know, a lot of questions on Twitter, folks are definitely worried, at least folks who follow us on social media. Some of the questions that we got people like Karan from Twitter, Rachel at Whole Milk on Twitter, questions like, will they uninstall this after everything settles down? What is the uninstall timeline? How long will this data be kept? Folks are worried, and we don't have those answers. But as privacy experts, as tech experts, how do we kind of demand that this data kind of self-destructs? Is that something that's fair to ask? How do we go about asking that from Apple and Google?
So this is currently part of the proposals. So the idea is, so the difference between a centralized and a decentralized approach is, you get and correct me if I make any mistakes in this, but sort of you get a temporary ID assigned to you, which also changes over time. Your phone doesn't record your whereabouts. It only records whenever you've been in contact with someone else who has installed the app. And as a result, this contact is stored on your phone. When you then test positive, and it's automatically deleted after, so the proposals, some of the decentralized proposals require that this data is only stored on your device, and it is automatically deleted after 30 days. And there's also a reason for this, which is there's no point in knowing that I've been in contact with someone 3 months ago. It doesn't really matter. What's significant is who I have been in contact 2 weeks before I tested positive or before I came sick. And only then, if I then indicate that I am sick or that I have tested positive, all these other people will be notified, but the data will not be uploaded to a central server. So the other people won't know who I am. They won't know where and when they have met me. They will only know that they have been in, however you want to define it, close proximity with someone who has now been confirmed to have tested positive. So this is why these design choices are so important, because at the other end of the spectrum, you could imagine your phone records all of your location, sends it to a centralized server in real time, and whenever people are then found out to be in proximate location, they find out where exactly they met that person, and that makes the chances that who was positive a lot higher, and also of this data being hacked or leaked or kept indefinitely.
Let me just add on that, because that's a very accurate description and is helpful, I think, in terms of that approach. The two things I would say to build on that, one is there sort of also is a semi-decentralized approach, and there's some kind of debate on that, which still uses the same random identifiers, but uploads the contacts that you've made. This is the Singapore approach. So it's still using Bluetooth, it's still anonymous for people who haven't been in the context of any exposure. And so there are those design choices to be made in that. And it points to the fact that, and then also there's fairly reasonable rumors, including that some European officials said this on a webinar in the last couple of days, that people are pressuring Google and Apple, governments are pressuring Google and Apple to provide more information. So we don't know specifically what that is, and is that to kind of have a more Singapore-like approach. There could be good public health arguments for that. But it points to something that was said maybe by Frederica much earlier, is there's both a technical part of how we want to talk about these issues and consider the design issues, but there also is a policy and governance part. And we want to make sure that whatever happens, even if something is designed right now to say delete after 45 days, which I think is the number in the Google Apple proposal, maybe it's 30 days. That's a choice that could change over time. So what's the broader framework that makes sure that continues to be the case, right? I mean, that's just a choice that a set of people in a set of companies are making. And that's where this kind of model bill that was proposed in the UK, or things that people like Sylvie Delacroix, who's one of our fellows, or some folks at Element AI have floated in terms of building independent intermediaries and data stewards to oversee this, come in, because it's actually a matter of oversight and rules. It's going to be equally important, or maybe even more important, in response to the questions that got asked on Twitter.
Yeah. Going back to, we have another question from our Mozilla team. What I'm realizing is that we need to get Jen from Firefox in this next panel, because she has all the great questions. So Jennifer, again, from Firefox team asks, going back to the whole centralized, decentralized discussion, how does having decentralized solution help epidemiologists / public health officials if the data isn't uploaded anywhere? Could you guys explain that?
I'll jump in on that. I think it's a great question, and that's the shortcoming of that approach. What those approaches the decentralized approaches do is they let people self-quarantine. They tell people, you have been in contact, you should isolate, follow the general guidance. It deliberately does not provide the sort of social graph to health officials in a way that allows them to take action to warn people directly. So that is the explicit sort of cost of that approach.
Yeah, individuals, you want to add in that? I saw your hand raised.
Yeah, just that, the decentralized approach can essentially help individuals decide for themselves to get tested or volunteer information to health authorities. And I think that's possibly a better way of going about things rather than governments making assumptions about them and forcing them into testing or quarantine instead.
Richard?
I just want to inject a small note of optimism here, which is to say Google in particular, but both Google and Apple essentially conceded that the most privacy enhancing way to deal with users is to keep the data on the device, not on the cloud, to allow multiple opt-ins, as Frederick pointed out. I mean, there's really sort of three separate stages where people opt in to being part of the system, and that the data at some point goes away, that there's a time limitation here. These are all important elements of sort of privacy by design that people have been talking about for years, for not just healthcare data, but all forms of data, or many forms that people find makes them most vulnerable and is most sensitive to them. And we now see Google and Apple stepping up and saying, yeah, we sort of agree with that. So I think we should sort of see this as maybe this is an interesting high watermark that we should take advantage of and say, okay, they have embraced these standards in this particular context, in this particular pandemic crisis situation. Let's get them to embed this as part of the overall thinking. Let's convince policymakers this is the way to go in many other ways. And then as Mark mentioned, let's bake that into governance structures. Let's create institutions and entities based on trust, and whether it's a civic data trust or some sort of fiduciary intermediary, where these kinds of decisions are being made for the benefit of the users and not just simply for the benefit of the corporations who are trying to make money off of it.
Yeah, I like how you laid it out there. Like, just this is what we need: clear opt-ins, clear expiration dates on when the data will be deleted. So my last question to you guys, because we're kind of going to the end of this, where do we go from here? How do we make it out of this pandemic while also using every tool in our arsenal within reason? So we're not left with kind of like a dystopic anarchy state. How do we do that? Frederick's like, I have no idea.
Well, I would say, I'm far more optimistic than I was a few weeks ago. And, it's a very big set of questions you're asking about. How do we find our way out of this? Like all of the ifs of, does contact tracing even help? It's only one, and even if it does, it's only one part of a bigger set of solutions around public health approaches and so on. So I think that how do we find our way out of this is too big a question, probably certainly for me and probably for this group. But if we, the things that give me some optimism are many governments, more than you see in a lot of settings, are taking these privacy questions seriously. European Parliament just passed something saying, decentralized approaches are the approaches we want to take. A lot of governments are talking and building links between epidemiologists and technologists and asking the questions about whether this is going to be effective. Maybe not enough, and probably at the political level there's a rush to do this. But the opportunity for at least a good number of countries to do this differently or decide not to do it, which I think is the current backroom Canadian debate. That'll be the interesting thing to stay engaged in the coming weeks.
Nice. I'll let all you guys get a final word in here. So Richard, what's the answer? What's the one-shot solution? Give us the answer.
There is no one-shot solution, just as contact tracing is not the silver bullet. But I think we could be looking ahead the next 3, 6, 9 months in our current situation. There's going to be this drive for immunity certifications, right? There's going to be this drive for antibody testing. So we're going to have these similar debates in those contexts. And so I think we should try as quickly as we can to sort of coalesce around the key principles we take from this existing debate around contact tracing and try to get ahead of those other ones. And then again, try to think about this more systemically in terms of what are the new institutions and norms we want to have out there that'll deal not just with those coming technology debates, which will be there, but then really the post-19, COVID-19 situation, the society we want to see, the web that we would hopefully embrace the technologies of that enhance our privacy.
Nice. Marshall, give us the answer. Solve COVID-19 on the spot right now. Tell us the answer.
Yep. Yeah, so this the question about opt-in or whether people should be required to use these solutions has come up a number of times, and it's worth calling out. You know, people like large parts of the world are opting into social distancing right now, and I think that provides a good sort of optimistic indicator of what might be viable here. You know, the approach that I think we should take is say, like, look, be honest about what the trade-offs are, don't engage in privacy theater, and encourage people to do the things to protect themselves and actually to give people information, other health authorities information that will be helpful. I think if you take that approach, rather than one which is sort of privacy theater and a requirement, it's actually a better model, and people will act. People have acted and they will act in good faith under that model.
David, where do we go from here? How do we preserve privacy and save lives?
You know, as Mark said, I think this is a great opportunity actually to kind of have a radical reimagination of what we do with technologies and how we deploy them. And I think what this is showing us is that you can't simply repurpose bad systems and bad tech into doing social good, which is, you know, the term that's been thrown around a lot. So redesign, reimagine technologies, see how they can be privacy preserving by design. You know, all of these amazing legal proposals like the one Federica has worked on need to be implemented, and you need to build people's trust going forward. And I think that's the way out of, you know, not just this pandemic, but any future kind of crisis that we have.
Okay, final word, Frederic, saving lives, preserving privacy. What would you do?
I'm also generally optimistic. There are lots of opportunities here. So what everybody else said before me, but I also, my concern is that we constantly underestimate how long this will take. And I'm worried that we're getting impatient at some point. So I think it's also continued interest and pressure to keep this privacy security momentum going and not make very bad compromises and choices when things get even more difficult at a later point and people are tired. But generally, I think there are a lot of hopes, and there's precedent for. I'm very glad that there hasn't been much AI thrown around in response to the crisis. That actually gives me hope, because it shows that this doesn't really work anymore at the moment.
Nice. Well, I think that's it for now. So thank you to everyone for tuning in and joining. You can follow us on Twitter and Instagram at Mozilla for more information about privacy, tech, COVID-19, and all of that. Tune in next week for Frederic's Twitter chat, dialogue and debate. I think it's a dialogue and debates also themed. And you can find this conversation as well as a blog post about it on foundation.mozilla.org on our blog there. So thank you everyone for joining in.
Thanks, everybody.
Thank you.
See you guys.
Thank you.